After decades uncovering hidden truths in legal cases, Aleida Lanza now turns her sight on healthcare, founding KTOC to give patients unprecedented control over their full medical records and to expose the invisible errors lurking in AI-generated charts. There's a lot to uncover, a lot to unpack. Thank you so much for being with me today.
Thank you so much for having me. It's an honor to be here.
So you began the company 2024. You have an illustrious background of working as a paralegal, as a CEO of other companies and law firms. You were in mass tort litigation support. You helped recover over $1 trillion in damages. What made you want to leave a career to start a healthcare tech company?
Well, yes, I've had the incredible honor and privilege to work for the titans of litigation in mass tort and medical malpractice and personal injury. Throughout this period, every single case that I was involved in that involved these facts, we had to produce a 10-year medical history, a record, of 10 years of medical records for each client that we served, which is a very onerous task. And I sought out to solve this really big problem that, patients aren't aware of until they have a need to access justice. Then they have to undertake this incredible, almost year-long process sometimes to recreate a 10-year medical record history. And it delays access to justice. They changed the rules of civil procedure precisely to ensure that all of this information has to be produced at the time that the plaintiff now files their lawsuit. So, it's an unprecedented need to, quickly aggregate a record that many of us are really poor historians. I don't even remember who I went to see in the past 10 years. And we are obligated to do that by the Florida Supreme Court, rules of civil procedure.
Why is only a fingernail full of information in our charts, and why can't we have full access to that in the case that you were talking about and in the history of your work? Where is it?
Right. So essentially, we paid a lot of money through Congress, and they paid a lot of, providers, whether they were Medicare or Medicaid providers. They got different amounts from $38,000 to $44,000 plus dollars to, change their systems to, paperless or digital systems so that we would be able to access our record.
So it's called ease. So it would be easy.
Right, exactly. And so, the air quotes stakeholders, which are basically the industry folks, got together and, they put together an architecture and a framework for electronic health records to be maintained. And it's wonderful that we have a standard, but when they created this entire framework, patients were never represented as stakeholders. And so therefore, healthcare, when they talk about stakeholders, they're never talking about the patient, ever. And, in my instance, I believe that the patient is the only stakeholder and everyone is a subsidiary to that stake. Access to information is, in the times that we need to make decisions that affect our lives, that our limbs or, our access to healthcare, information is power. And I do not accept that, because that's how they created it, that's how we have to receive it. In healthcare, if you can't see the same information your doctor can see, they're lying to you. Every patient portal in the United States is lying to every patient in the United States. How? Because they only show you a fraction of the record. It's called the Fast Health Information Resource. They decide, the hospital will decide, I don't know, are we going to show them, their images? yeah, no, we don't want to do that, because anytime you show a patient information, that's information that they can, potentially discover evidence of medical malpractice. And so this entire industry was created to avoid detection of medical malpractice. Full stop. And we paid for it. And, I don't know of any other industry, anywhere, whether it's finance, architecture, banking, whatever it is, retail, when you purchase something, you get a receipt. And, we go through healthcare, and to get a receipt to show this is what you did, I can get brakes done in my car, and I get the serial number of the parts that they put in there. I don't have to go and pay $1 a page to find out, and get what I call is a receipt. What did you do for $250,000 that my insurance company paid you? To me, the medical record is the receipt. There is no other industry in America that is allowed to hide receipts. It's incongruent. And so, I decided to leave at the truly top of my field, working for what I believe are the best attorneys in the country, working some very valuable work. But I saw a quote by Mark Twain that said the two most important days in your life are the day you're born and the day you found out why. And I had a client call me crying because he was asked by a hospital to pay $9,000 to access his medical record because he needed it for a second opinion, for, a serious, procedure that they were considering. And, it's not just about, having information to make decisions. Why is it that, and I invite anybody who's listening, test me. I come with receipts. Go to the developer section of any single health tech that or electronic health record system, no matter how big they are, and look at the developer documentation, and look at, even when you go through the lengths of, requesting a full data dump from these systems, from these frameworks created by these stakeholders that never considered patient stakeholders, you'll see that they call a full data dump. Here, come get your full data dump over here. As a patient, to me, that's like everything, right? It's not. It's the core clinical record, because again, they put everything behind a paywall, because you don't realize that there's a plethora of information in your chart that we should treat like assets, like stablecoin. Because, if you paid $250,000, or your insurance company paid $250,000 for your care, that asset, that value is maintained throughout the rest of your life, because that's your baseline.
But why aren't they sharing it? What's in it for them or not in it for them? Okay,
so the willful and intentional fragmentation of our healthcare system was because they created the architecture that way. And so even when, you can connect to health systems now, even when you go and download any health app that you can download to see your records, you barely see if, the name of the provider and the date, and barely any other information. We wanted to solve the fact that you're entitled to every bite of information, and not just the paper record, or, the HL7 construct, the DICOM images, the itemized bills. We want to make sure, because patients are entitled to access every part of the digital record, including the hallucinations that are traced in the architecture of these systems. And who's detecting them? Who's making sure that they're all gone? Because they don't show you that they ever were there, or that, or that you consented to using them.
So we're talking about hallucinations. In other words, the AI generated information is not real. It's not having to do with someone actually having an hallucination. It has to do with the fact that this is what was brought up, and it's not accurate because it's like you said earlier, listening to Siri's radio or asking Siri to find you something, and they give you something totally different that has nothing whatsoever to do with what you've asked it.
Anybody who uses voice prompt in any chat setting, in any Siri, Alexa, or your own phone, we know it's not accurate. And I sent you a link earlier that there was a JAMA study that showed that in emergency room settings, ChatGPT was reporting, and this is in I think June 2025, they were reporting up to a 47% incidence of hallucinations in emergency room settings. And I don't know about you, but 47% when I was in school was a failing grade. And that is in the wild now, currently embedded in hospital systems that you're not even aware are there, and they're listening to you.
How is this uncovered?
Well, it's uncovered because you have a right of access to your digital record.
But how did this help you? How did this bring you from what you were doing to where you are right now at KTOC? That you said, okay, there's a disparity what's going on in our world right now between what the patient experiences, what the hospital experiences, and what's going on in the middle of for patients to receive their records in a full stop. Here it is. Hand it over to me.
Yes, exactly. But the issue is more than that. To me, it's more of a security issue. You have an intrusion. To me, there's a breach because there's another party, a third party that you did not consent to, that is listening and is injecting its hallucinations directly into your chart. And you have to rely on your provider to catch them all, like Pokemon. And, healthcare has been reduced to having doctors, correct hallucinations by scribes that, you did not consent to listen to your encounter, of which you have an expectation of privacy. And they're being not only violated at scale, but more importantly, the kinds of hallucinations that can go into your chart. I sent you the study. Even any percentage that shows that can either deny access to treatment or actually cause harm has already been documented by the Journal of the American Medical Association. And I defer to the experts, the real experts, in being able to detect them. The issue is there's no radar. Patients aren't even aware that this is happening. They're not aware that they're being effectively wiretapped, and that the sequela of this frenzy to surveil has now gone into our healthcare system, and they're not showing you. When you go to your doctor, when I go to my doctor, they don't turn the computer around and say, "Hey, is this correct?" They never show you what's written there. And you need to, I took a minute and said, that was my why. I realized that's why I'm here. I came here and, to solve access to our health information, because it's literally access to justice.
So KTOC is described as the first Medicare-approved app in Medicare Connected App Directory. And it gives patients access to their full claimed recorded history. How does that work? How far have we come? What are the next steps for someone that's interested, that's listening, and what can we do to really get full claimed medical records?
Right. So, we are patent pending, and, I set out to solve the ability to curate our whole history in one click. And the way that we do that is you go to our website, ktoc.com, and as a patient, you can sign up as, to a patient module. And we have different plans. So for $100, you can go and connect to your carrier. You scan your driver's license and you scan your health card. We know who your health insurance company is because we're connected to them.
That's really scary. So much information is so public.
Right.
But not our records.
But you don't own it and you don't see it. And if you
But
can't,
it's my body, right?
But if you can't see what your doctor sees, then that's what I wanted to solve, so that you can see everything that your doctor can see. Full stop. So, not one field of data less than your provider. And so we, with your consent, of course, because you have to log into your carrier, and although we're connected, you give them consent to give us your claim history. And if you have 7 years of claim history and, there's 30,000 encounters there, we pull your history over. And so that in one click, you can relay 30,000 demands for a right of access to your full record. And the difference between KTOC and every other health tech that you see is that we can't show you that information immediately because the law does not allow us to. It gives your doctor 30 days to show you everything. So we start the timer, and the minute you send that timer starts, and they have exactly 30 days, because on the 31st day, you can report them to HHS, and they're subject to up to a $1 million fine for that violation. And we have all the evidence to provide so that you can report them, or you can report them directly to your carrier and say, excuse me, you paid this money to this provider and they're refusing to give me my record, so I'd like a fraud investigation, because they're not giving me the receipts for whatever it is that they billed to you. And at the end of the day, accountability is ours. Agency is ours. Stakeholderhood is ours. And I created KTOC to be the representative stakeholder of the patient and defy every single firewall that this air quotes stakeholder industry created to preclude access to patient access to their own record and put it behind a paywall that's $1 a page. You shouldn't have to pay $9,000 to get your record ever. You shouldn't be punished because you're a chronic care patient and you're managing, several conditions. And so then it costs you more to access that information so that you can manage your care. That is offensive to me at a visceral level. And I left everything I have and everything I own to stop this. And so KTOC is literally the only Medicare approved connected app that you can find us on the Medicare.gov website. We are the only health technology that will show you your full record and show you, and so that you will see everything that your doctor can see about you. Everywhere that you have been to, everywhere that appears in your history, and anything that doesn't appear in your history because you remember you were on a cruise and you went to see that doctor and you paid out of pocket. I don't know. We have the ability so that you can aggregate this long list of requests to ensure that you add everybody that you've ever been to. We have the list of every physician in the United States. You can just start typing their name and you'll see all the names that come up directly from CMS itself. It's the MPPES directory. And so you can find them and you can find their current location, and it's all based on their license, but you can find them and add them. And so you don't have to worry about looking them up or finding their address. We got you. Just add them.
Young business, 2024.
And we are the most powerful health technology in the United States. We are more powerful than all the big tech providers put together. Why have you never heard of us? because they want to make sure that you don't hear about us.
Well, you have your 15 minutes or 30 minutes here with me. This is a start, if not other places as well. Tell me a story. Tell me something that during that time in your being a newbie in this industry that really affected, so our audience understands the gravity of what you're doing and how important it is for patients to take their ownership of their own health, their records, and their life.
Yes, absolutely. So, for example, I'll give you an example where we had communicated with public defenders in the state who have to pay $1 a page to be able to get the evidence that they need to, defend their defendants, because it's their constitutional right. And so currently these public defenders pay $1 a page for a record that we eliminate the $1 a page. And we just have a flat fee. And as a matter of fact, it's not just the $100 flat fee for the whole record. We have the AI detection tool. So for $25, you can do an AI audit of your entire history to see if there's ever been an incident trace hallucination that was ever present in your chart. So all of this information, for example, when we attempted to resolve the request of these public defenders, I learned about in Florida, a $2.8 billion no-bid contract to one company who, for this money, contracted to manage health for incarcerated individuals in Florida, as well as their medical records, including the observance of high tech, which is the law that, in addition to HIPAA, says that you're entitled to a right of access to your full record.
And so I'm going to stop you for 1 second, because this is the central mission. When we first met off camera about a couple of days ago, you said, this is the reason why. I have my why, and you talked about this with me. So continue on.
Right. So when we approached the Florida Department of Corrections to be able to facilitate, meaningful access to the indicia of evidence that public defenders need, we were met with a hard stop. And I was told in writing by the signator of the $2.8 billion no-bid contract, in writing directly from the Florida Department of Corrections, the general counsel for the Florida Department of Corrections put in writing that incarcerated individuals are not entitled to their health record while incarcerated. I'm going to repeat that.
Please do. I was going to
Incarcerated individuals are not entitled to access their medical record while incarcerated. That is astounding to me, that not only do we have a $2.8 billion no-bid contract to one company that says that they are required to facilitate access that includes high-tech observance, that the general counsel for the Florida Department of Corrections protecting that no-bid contract, because how else? If patients can't see their record, how is anybody going to learn what happened to those $2.8 billion? Where's the accountability in that? And at the end of the day, these individuals, they're not, test subjects. They're human beings. They still have federal protections of HIPAA and high tech while they are incarcerated. They have every right of access to their record while incarcerated. They don't have to wait until they leave.
What was the next part of this conversation that you had?
Well, that's where it stopped with them. I've reported them. As a matter of fact, the Chief Inspector General for the state of Florida wrote to the Florida Department of Corrections, as well as the Chief Inspector General for Miami-Dade County also wrote to the Florida Department of Corrections. And so far, nothing has happened. I invite the community to investigate and call their senators and their representatives and their local, representatives and inquire about the $2.8 billion no-bid contract which, I'm happy to provide you a link in the Florida Financial, division website.
Do you have it on your head?
I don't have it on my head. The company is Centurion Health. And if you go to the Florida's financial auditing website, because they have a website that keeps track of all of the all of the finance agreements that we pay for in Florida, it's there, and you're invited to go look. $2.8 million. It's still currently in effect. I think it was going on for 5 years. We approached Centurion Health to facilitate access by API, just like we did with Medicare. And in fact, the Agency for Healthcare Administration in Florida filed 5 administrative lawsuits against 5 different Medicaid organizations in Florida who, again, were, data blocking. And, this is a mission. It's, you have no idea the things that we have to do to force, compliance with federal law.
What happens to the incarcerated individuals?
They still don't have access to their health record today while incarcerated.
How do they get treated?
Good luck. I have no idea. Nobody knows. Where's their transparency? Who's looking?
And where is the money going to?
Exactly. Because we're supposed to be, facilitating rehabilitation of these patients. And if they can't self-report that, yes, they received these services, then, who is? So, it's the fox is the landlord, and we are all in the hen house.
With your app, there's 2 different segments. There's the patient, and then it could be legal, it could be doctors. Who else is going to engage? Who needs this right now?
Right. So we facilitate access to the health record for patients. And the patient is the absolute owner and solo administrator of these records. No one shares their data without their consent. As a matter of fact, it's in our terms of service that we do not consent to having this information that we aggregate, because the information that we aggregate is publishable to a jury. And, the records that we receive go into the deliberation room, not just the courtroom. So that kind of evidence is unimpeachable. And so, to curate all of this information in one place, we want to make sure that no one else has control. So although we made it possible for the legal community and law firms, because that's my world, where I came from, and I know that this is what we need to access justice. And so if we can quickly gather this information, and if there is a need, you can use it for yourself. But, if you have a need for justice, then here's a way that you can, give us consent to share your information with your legal counsel, and then you send that invite. And at every moment, you are in control of that invite. You can turn it on and turn off access, and it's immediate. So you can give them access for an hour or never give them access at all. You're in full control of who has access to what, when, because it's yours.
So transparency,
control,
and control.
Yes.
Those are your parting words. You got 30 seconds. Talk about last thing that we might not have talked about in this interview that you want our audience to know about the work that you're doing at KTOC, and anything else important that you think our audience needs to know.
Well, we are soon going to be connecting wearable devices so that you can, connect your history and, for example, look at your blood pressure, anytime it was ever taken by a clinician versus, what your Apple Watch is reporting. And that's how we solve static medicine. And my pearl of wisdom to you is, please, if you spent $1 for healthcare, that dollar is like gold. It never loses value. And if we understand that all of that information, when clinicians, take all this information and write it down. That information will serve you for the rest of your life. You're leaving money on the table, not just money. You're leaving insurance that can help protect you and keep you safe from unnecessary treatment. It could keep you safe to make sure that you do get treatment, because maybe there's something there that your provider, learns, hey, this is really important. Let's change the course of treatment. But without you being the owner of your history of, seeing everything that your doctor sees, you're never going to be in control. And that's, my gift to you is take control. Don't let anybody else control your health journey. See every bit of data and own it and control it. You're entitled to it. And everything and every health app that is essentially, selling you a fraction as if it is a whole, please do some research. Please. You're entitled to everything. And if you don't see everything that your doctor sees, it's snake oil. The end.
Aleida Lanza, thank you so much for being with us. KTOC, if you want more information, it was eye-opening. I'm bug-eyed. Now I got to get on the internet and just check everything out. Thank you so much for being here with me today. And thank you so much for joining me on Fara Sax. Until next time, take care of yourself.